Welcome to the Basic Obstetric Ultrasound Training Course for Healthcare Providers. Ultrasound plays an important role in identifying pregnancy-related conditions that put the mother or fetus at risk during delivery. In most low-income countries, there is a shortage of people experienced in performing pregnancy ultrasound. This course was created to train healthcare workers to perform basic pregnancy ultrasound in parts of the world where formal training is not available. The videos, as well as other educational materials, available at tinyurl.com/UW-ultrasound, are designed to be used in a 2-week ultrasound course. The hands-on sessions in the trainer's guide are an essential component of this course and must be supervised by an experienced ultrasound practitioner. This is not a comprehensive pregnancy ultrasound course and does not result in an official certification or diploma. After you finish the course and pass the written and practical tests, we strongly recommend you have at least 40 hours of scanning experience with clinical mentoring before you undertake unsupervised scanning. My name is Dr. Christina Adams-Waldorf, and I will be narrating this 14th video in our Pregnancy Ultrasound series. This video will focus on ectopic pregnancy. Please visit our website for access to all of our video and training materials. In this lesson, you will learn how to identify the signs of an ectopic pregnancy on ultrasound and assess the risk level of ectopic pregnancy to respond appropriately. A pregnancy should occur in the uterus. Any pregnancy that occurs outside the uterus is called an ectopic pregnancy. It usually occurs in the fallopian tube and happens in about 1 to 2% of pregnancies. Ectopic pregnancies do not survive. It is extremely important to identify ectopic pregnancies because they often rupture. This can cause life-threatening bleeding for the mother. There are several types of ectopic pregnancies which are named based on their location. An isthmic or cornual ectopic can occur in the fallopian tube segment that is just inside the uterus. This is particularly dangerous as rupture often causes massive bleeding. Other types of ectopic pregnancies include a tubal, ovarian, abdominal, and cervical ectopic. Any woman who has scarring and narrowing of the fallopian tubes is prone to ectopic pregnancy. This could be caused by a number of factors, including prior ectopic pregnancy, pelvic inflammatory disease, or a prior sexually transmitted infection, tubal surgery, history of infertility, or use of an intrauterine contraceptive device, or IUD. The use of an IUD does not increase the risk of ectopic pregnancy, but if a woman becomes pregnant with an IUD in place, the most likely location for the pregnancy is in the fallopian tube. Patients with an ectopic pregnancy will commonly report pelvic pain, but the classic signs of ectopic pregnancy include the 3 findings of pain, bleeding, and an adnexal mass. Pelvic pain and bleeding can have several causes. The 4 main conditions you should consider include a normal intrauterine pregnancy, an abnormal intrauterine pregnancy, an ectopic pregnancy, or a condition unrelated to pregnancy. For example, cervical polyps, a cervical precancer or cancer, and infections may also cause vaginal bleeding during pregnancy. Pelvic pain in pregnancy can also be caused by ovarian torsion, which means a twisting of the ovary, and appendicitis. This lecture will cover ectopic pregnancy, and we discussed abnormal intrauterine pregnancies in a prior lecture. We will not cover conditions unrelated to pregnancy in this lecture, but we may see examples in our clinical time. Remember that to confirm a normal pregnancy, you must see a gestational sac with a yolk sac or a fetal pole. If you see only a sac without a yolk sac or fetus, it could possibly be an early intrauterine pregnancy, an abnormal intrauterine pregnancy, or the pseudogestational sac of an ectopic pregnancy. If you can clearly identify an intrauterine pregnancy, there will be almost no chance of an ectopic pregnancy. If the patient has undergone infertility procedures, it is possible, although rare, to have both a normal intrauterine pregnancy and an ectopic pregnancy at the same time. For the care of a patient that has not had infertility procedures, identification of a normal intrauterine pregnancy means that she can proceed with routine pregnancy care. But if you have any clinical concerns, despite the ultrasound, don't hesitate to refer the patient to the referral hospital. A normal uterus with no gestational sac, meaning an empty uterus, could be an early intrauterine pregnancy, a complete miscarriage, or an ectopic pregnancy. On a scan of an ectopic pregnancy, you're most likely to see echogenic free fluid or a complex adnexal mass. You can see fluid in the endometrial cavity or see a thickened endometrium, but there are usually other findings. From time to time, you may see a gestational sac outside of the uterus. Bleeding from a ruptured tubal pregnancy is the main cause of death in an ectopic pregnancy. If you see a large volume of free fluid that is echogenic, this is a very worrisome sign for hemorrhage and ectopic pregnancy. In this sagittal view, we can compare smaller and larger amounts of anechoic free fluid in the pelvis. Please pause the video now to ask participants to identify the free fluid in these images. Here we have pointed out the free fluid with arrows. The small amount of free fluid seen in the left image may be normal. The larger amount of free fluid seen in the right image is more worrisome. Not all free fluid will look black. In this image, some of the fluid is black, but some of it is complex, with scattered echoes. This is common when a patient has bled from a ruptured ectopic pregnancy. Here we have labeled the anechoic and echogenic fluid, which is likely blood clot. This is a very worrisome amount of free fluid, and this patient needs immediate referral to a hospital. This is another example of how free fluid can look when there is bleeding from an ectopic pregnancy. Please pause the video now to ask a volunteer to identify the free fluid in this image. In this image, there's a large amount of echogenic material in the posterior cul-de-sac, which is what we call the space just behind the uterus. This is likely blood clot. Here is another example of echogenic free fluid in the posterior cul-de-sac. We have outlined the fluid here to make it more obvious. Another finding on an ectopic ultrasound is a mass in the adnexa, which is the region of the ovary and fallopian tube. The mass is usually complex and poorly defined. The mass could be a hematoma, which is a collection of clotted blood that appears solid. Or it could be the ectopic pregnancy itself. The mass may appear hypoechoic, hyperechoic, or have a mixed echogenicity. It may also contain a hyperechoic ring. Although the mass is separate from the ovaries, it is often difficult to identify them separately. The mass may appear very close or as a large ovarian mass. Here are two examples of normal ovaries from the last lecture. In the left image, the ovary is round and solid, shown at the red arrow. The other structure is the uterus. As we learned in a previous lecture, the position of the ovary can vary, but it is usually near the uterus. The ovary in the right image has a more common appearance. It is oval and contains small cystic structures called follicles. In this image, the arrow points to an adnexal mass. Do you see it? Please pause the video now to study the image more closely and try to identify the borders of this adnexal mass. Here we have outlined the mass. It is irregular in appearance and the borders are hard to see. It has no follicles or corpus luteum. Here is another adnexal mass. Please pause the video now to ask a volunteer to outline the shape of the adnexal mass. Here we have outlined the mass to make it more obvious. Notice how it does not look like a normal ovary. Notice the irregular shape and unclear borders. There are no follicles or corpus luteum. Sometimes you might identify a gestational sac outside of the uterus. This is called an extrauterine sac. It is an uncommon but possible sign of an ectopic pregnancy. Usually, you will see an echogenic ring outside the uterus that is distinct from the ovary. You may also see a yolk sac or fetus in the ectopic pregnancy. The fetus itself may have visible heart motion or not. This image has an example of a gestational sac that is outside the uterus. Please pause the video now to ask a volunteer to identify the ectopic pregnancy and the ovary in this image. Here we have labeled the ectopic pregnancy that contains both the gestational sac and the echogenic tissue that surrounds the gestational sac. Notice that there is no surrounding uterus around the ectopic pregnancy. A fetal pole is visible inside the gestational sac. The ovary contains several follicles and is nearby the ectopic pregnancy. Here we have labeled with crosses the complex fluid that surrounds the ectopic pregnancy and the ovary. This is blood clot and suggests that the ectopic pregnancy has begun to rupture. Here is another example. Can you see the gestational sac and the ovary in these images? Please ask a volunteer to point out these structures and pause the video. Here we have outlined the ectopic pregnancy, ovary, and echogenic fluid around the ectopic and ovary, noted with crosses. This is another example of an extrauterine gestational sac. Here we have outlined it to make it more obvious. A fetal pole is visible in the gestational sac. Not all fluid in the endometrium will look anechoic. Most often, the endometrium simply looks thicker and echogenic, with possibly some small anechoic fluid component. The anechoic component may be mistaken as a gestational sac, which is called a pseudogestational sac. A real gestational sac will have a fetus or yolk sac, which you need to see to confirm an intrauterine pregnancy. If you do not see a gestational sac, but see echogenic or a large amount of free fluid, or an empty uterus with an adnexal mass, refer the patient urgently to the referral hospital. This may be due to an ectopic pregnancy, which is an emergency. Let's review the complete guidelines for first trimester pain and bleeding. When we do an ultrasound, we should ask ourselves 3 main questions. Do I see a gestational sac? Do I see anything else? What is the appropriate follow-up? If a patient complains of pain and/or bleeding, and you see free fluid or an adnexal mass, refer immediately to the hospital. These patients are at high risk for an ectopic pregnancy. The risk is especially high if there is a large amount of free fluid or if the fluid is echogenic. If you see a gestational sac and the mean sac diameter is more than 20 millimeters without a yolk sac, or more than 25 millimeters without a fetus, or the fetus has no heartbeat, refer urgently to the hospital. These cases may represent a mix of ectopic pregnancy, blighted ovum, and fetal demise. If you see a gestational sac that is less than 20 millimeters without a yolk sac, repeat the ultrasound in 2 weeks. Let's review the key points. Ectopic pregnancies occur in 1 to 2% of all pregnancies. Ectopics can cause bleeding, which can be life-threatening. An intrauterine pregnancy on ultrasound makes an ectopic very unlikely. Any patient with suspicion for an ectopic should be immediately referred to the hospital. Questions for review. What is the most common location of an ectopic pregnancy? The answer is the fallopian tube. What symptoms will the patient have? What can you feel on clinical exam? The patient will often have pelvic pain and bleeding. You may feel an adnexal mass on exam. What should you do with these patients? The answer is an ultrasound. If the ultrasound suggests an ectopic pregnancy, send her to the referral hospital immediately. What are common signs of ectopic pregnancy on ultrasound? Common signs include echogenic free fluid and a complex adnexal mass. Which ultrasound findings in early pregnancy would prompt you to ask a patient to return in 2 weeks for a follow-up scan? The answer is seeing a gestational sac less than 20 millimeters without a yolk sac. If there is any suspicion for an ectopic pregnancy, refer emergently to the hospital. Thank you for your attention and interest in learning pregnancy ultrasound. Please pause this video now to ask your instructor any questions about this course. We thank the following individuals who played a major role in course development: Dr. Robert Nathan, Dr. William Marks, and Nicole Goldsmith, registered sonographer. Many other individuals contributed valuable time and expertise in the instructional design and materials development, including Dr. Christina Adams-Waldorf, Dr. Scott Barnhart, Dr. Michael Kawuya, Susan Kingston, and Stacy Lissett. Finally, we wish to thank Dr. William Marks for the use of images from his book, Ultrasound, A Practical Approach, and Jennifer Summers and Jan Hamanishi for graphic design and illustrations. The University of Washington Department of Radiology has trained healthcare workers in pregnancy ultrasound in many parts of the world. If you have questions about this video or course, please contact Dr. Robert Nathan, Dr. William Marks, or Dr. Christina Adams-Waldorf. This course was collaboratively developed by the University of Washington Department of Radiology, Obstetrics and Gynecology, and the International Training and Education Center for Health, ITEC. It was made possible through a grant from the GE Foundation. Consano also contributed funding. We are grateful for the video production sponsored by the University of Washington Institute for Simulation and Interprofessional Studies. Please visit our website at tinyurl.com/UW ultrasound to access all of our training materials. This material is copyrighted. You are permitted to copy, distribute, and post to websites. You are permitted to modify the content to adapt to specific populations and user needs on the condition that you include attribution to the University of Washington and retain any copyright notices and citations and attributions included in the original Basic Obstetric Ultrasound Training for Midwives. The material in this video is provided for information purposes only. The University of Washington Institute for Simulation and Interprofessional Studies does not take responsibility for the accuracy of the content in this video.